Hello, thank you for choosing to bring your child to therapy. My name is Gloria Smith Cisse, and I am a licensed professional counselor, licensed master social worker, and I'm with the Southern Center for Choice Theory, but contracted through the Rainbow House Children's Resource Center in Warner Robins. This is what we call an informed consent, and basically it's an opportunity for us to tell you a little bit about uh, who we are and the services that you're going to be provided, or your child will be provided. As I stated before, my name is Gloria Cisse. I'm a licensed professional counselor, a licensed master social worker. I am certified in choice theory and reality therapy. I am also a TFCBT certified therapist, and I am very well trained in play therapy and trauma treatment. And I am, because I am a licensed professional counselor, a, uh, a licensed professional clinician, period. I am, I have been certified by the LPCAGA to provide supervision to students who are completing their master's degrees in social work or counseling or marriage and family therapy, and even psychology. And these students have to have supervised internships or opportunities to practice their skills. When I was in school, to get my first master's degree, I had a lot of problems finding a placement site, and someone offered me assistance so that I could get my degree. We can't get our degrees without our placements. And I decided when I was eligible to supervise, I would do the same thing. And that's what I'm doing. But I want you to understand that these young people under my supervision are held to the same standard of confidentiality that I am, and they must maintain the same type of confidentiality that I am required by law and our code of ethics to adhere to. So after a intake interview and the completion of some documentation, right now we're having to do everything virtually, but the interventions that we use to work with your child in therapy are things like play therapy, which is a set of techniques or a type of therapy that has been researched and proven to be effective in working with children. Actually, they tell us that play is the language of children, and it is the most effective way to help children to learn to um, manage the symptoms that are associated with having experienced any sort of negative event in their life. Trauma focused cognitive behavioral therapy is another set of interventions that we use that has been researched, and the research tells us that it's very effective in working with children who have experienced either sexual, physical, or psychological trauma. Trauma informed reality therapy and choice theory simply means that we are not only viewing our clients through a reality therapy lens, but we are viewing them through a lens that is trauma informed, meaning that we have learned as much as we can about trauma, the impact of trauma on the nervous system, the impact of trauma on the brain and the body, and techniques that work in conjunction with reality therapy principles to help our patients, our clients, to have as much success in therapy as possible. We offer NOC groups, which is a non-offending caregiver group for our parents and caregivers who are trying to somehow normalize in the um, experience of having their child abused by someone in their family or someone that they know. We also have teen groups for girls and boys. You can talk to us at the end of your interview if you're interested in participating in any of these groups or having your child or children participate in any of these groups. The majority of our therapy sessions, however, are individual. And that means that your child will have a time in a day that they should come to therapy. For instance, if your appointment is at 2 o'clock on Tuesday, your child's appointment is at 2 o'clock on Tuesday, that will be their appointment time, as long as they're with us, unless something comes up. The length of treatment varies because every child is different. Some children present with no symptoms, and some children come to therapy with a lot of symptoms. And some children have some difficulty connecting with people they don't know. So we work to help this process be as smooth and as child-centered as possible. As I mentioned earlier, we have the children are scheduled for a weekly appointment, and so at the same day, the same time every week. We also know that children live with their parents, and that their parents are going to be responsible for bringing them to treatment, but also that we ask that you join us in becoming kind of our co-therapists in this process, meaning that we hope that you will learn and practice some of the techniques that we use with your children, so that you can use them yourself with them when we're not in therapy. Commitment is very important. It's very important that you decide to come to therapy, bring your child to therapy on a weekly basis. But what we also know is that life happens, and so if there a time arises that you can't bring your child to therapy, please call or email us to let us know. And if you decide that we're not the right therapy for you, that's great too. It's your choice. So please remember to just let us know. Send us an email or leave a message on our voicemail to let us know that you've made that decision. If you miss your appointments consecutively, what will happen is you will receive a discharge notice, which will remind you that of our policy. If you miss three appointments, then your child will be discharged, because if you don't tell us, then we assume that just missing appointments means that you're no longer interested in coming to therapy or bringing your child to therapy. So please know that you'll receive an email or a letter in the mail stating that, and then you have 14 days after you receive that letter, or the letter is written, to respond to us and let us know what your intentions are. But we hope that you will bring your child to every session that's scheduled for them. Thank you for choosing to bring your child to therapy. You're a phenomenal parent. I know that this has been a struggle, right? It's been a struggle. It is probably one of the things that we as parents dread the most, and that is for something to happen to one of our children. But you believe in your child. You believe in helping your child in whatever way you can, and you believe that it's possible that therapy can help. So think of yourself as wonderful. All too often we encounter parents who don't believe their children, even who think that their children won't remember what happened. I'm going to tell you that's not true. They do remember, even if they don't have a cognitive memory and a thinking memory of it. They have a memory that's locked in their bodies, so they don't forget. Sometimes parents also think that kids will just get over it, right? Or they don't believe in therapy. That's okay, but it's wonderful if we just give our kids an opportunity to have the best life possible. So thank you again for choosing to bring child to therapy. If you have questions, or you think you might not be able to attend your appointment, please contact us directly at 478-741-1268, or send us an email. Miss Hodges is our office manager, and that's zhodges at the Southern Center for Choice Theory.com. But I look forward to working with you, and I'm going to give our interns an opportunity to introduce themselves to you now.